right, so welcome back to Module 2 here in Foundations of Healthy Lifestyle Management. So today, or this week, our topic is going to be on interdisciplinary practice. One of the core pieces that's important for all of us to talk about, to think about, to try to practice and put into play is working with others, right? It's some of those things that our parents try to teach us at a very early age. Play in the sandbox nicely together, right? But it's so true in when we're working with the care of others. And one of the things that is absolutely critical when you get to talking about what does this major mean? What does this profession mean? For us here at Creighton, this isn't about working with people in a silo. This is about working as a member of a team and having a specific role within that team to help this individual you're working with get to the place they want to be, right? So it's not about a healthcare provider saying, this is my stuff, nobody gets in here, nobody plays in this sandbox with me because it's just mine, right? Those things when we were 2 years old, that is still coming right back around no matter what age you are. We know that this is the right way to go in working with folks. We just unfortunately have a structure that doesn't necessarily support it all the time. But one of the things that's critical, as I mentioned, that you understand, that I understand about our degree in healthy lifestyle management that we're working on, is that we're part of a team. We're not doing these things in a vacuum. We're not doing these things with folks and not communicating with their other people who are helping to care for them also. That includes other professionals, as far as health and wellness professionals, it includes their family and anyone else who would be necessary. And of course, not to forget, it includes the person you're working with. Sometimes our healthcare system doesn't necessarily support that. You just do what I say because I'm the healthcare provider who has all the information, and you just do what I say and everything will be all right. That's not the way we do business, not the way we should be doing business. Unfortunately, it is the way it is in some places. But so anyway, so that's the reason for this topic. A whole module for it. I've got some resources at the end for you also. So interdisciplinary studies, but so here's where I want to start with. There's different ways to look at this, or at least different words to use to look at this. I used interdisciplinary because it works for what we're doing here, but I'm going to propose a new word in a couple minutes that I think is probably better for this. So interdisciplinary, what does it mean? Typically the definition for this, and this is my own definition, by the way, for this: two or more disciplines from a unit that come together to collaborate. So these have been playing out in healthcare. If you think of healthcare for a long time, in interdisciplinary practice. If you ask somebody, do you practice interdisciplinary? If they're working in medicine, they may say, sure, because I am, say, a cardiologist and I work with a pulmonologist to care for this individual, and that's interdisciplinary care. So sometimes within that same unit of medicine, it can be thought of in that way. And that's an example of practice for interdisciplinary care, right? But there's also education when you think about interdisciplinary education. And that may be where two departments come together, two departments, say, in the College of Arts and Sciences, that come together for a collaborative or common purpose. An example that I give you here is anatomy and exercise science. You can think of the commonalities between the two, and it would make sense to combine them together in certain areas to work together. But at Creighton, they typically think, and this is just the way people perceive or interpret the words, is interdisciplinary is usually used for non-healthcare collaboration. It's really interesting that way. I'm not sure why, but that is the case. But then when you talk about healthcare collaboration specifically, the word interprofessional is used. Why someone who's an anatomist isn't a professional, don't know. and I don't agree with it. When we talk about our medical anthropology folks that we're working with in this major, certainly they are. I consider them professionals, and of course everyone else would too. So why don't we use interprofessional for everyone? I don't know that answer either, but it's interdisciplinary use in that sense, interprofessional when we're typically talking about healthcare. But according to the World Health Organization, this is how they defined interprofessional, or when two or more professions learn about, from, and with each other. So to me that makes sense to generally use interprofessional practice, interprofessional education, no matter who or what type of collaboration. But when you talk to folks in the undergrad world, at least here at Creighton, that interprofessional to them means, in the health sciences, interdisciplinary means their type of collaboration. So here's a new word for you, or maybe it's not new, but this is what I think we should use: intercollaborative. So how about that? So other people are using this word too. I didn't make it up, and I can't take credit for that. But it seems to resonate better. Okay, we're talking about collaborating together and coming together for a common purpose. It doesn't matter what your background or titles or whatnot. So intercollaborative practice, intercollaborative care, intercollaborative education, to me sounds probably less threatening to a lot of people, and maybe is a word that we might want to consider using. So what does this mean? Why are we doing this? Why do we come together intercollaboratively or interdisciplinary or interprofessionally? Why are we doing this? Over the last few years, it has been recognized that when we work together in a healthcare setting, outcomes are better. Surprise, surprise, again, going back to what our mother tried to teach us when we were 2 years old, that plays out in many situations. We know it works in the workplace that is not associated with healthcare. We know it works within healthcare. We know it works within education. There's lots of studies to support this. We probably don't need to go into what those are, and we could certainly make a very long list of the advantages of why working together is better than working working apart. But the triple aim was something that resonated a couple years ago, or was put out a couple years ago, and it seemed to resonate with a lot of folks. So what is the triple aim? Let's hear what I've got for you on your screen. So it came from the Healthcare Improvement Institute for Healthcare Improvement, and there are really three main parts to it. Improving patient care, and this is their language that they use. Improving health of a population, and then reducing the per capita costs. Now these were really centered around healthcare, and of course what we're doing here is health, and it is caring for folks to improve their health, so you can think of it as healthcare, but this is really talking about it in the healthcare system and the models that we know as far as healthcare goes. But this can be interpreted and transformed in a way that is more inclusive than just our healthcare system as we know it. So patient care doesn't have to be patients, right? It can be the individuals that we're working with in a wellness program, and we don't call those folks patients because they're not sick. So or as we consider them in the healthcare setting, and then improving their patient experience. It just doesn't mean that it's satisfaction. I'm satisfied with my care. That it's more than that. It's about the entire experience from top to bottom, and every individual who works with that patient or that participant or that individual person, whatever you call it, that what they're receiving is what's best for them in their particular situation. So it's the entire experience from top to bottom. It's not just a questionnaire that you fill at the end. Were you satisfied with the care you got? And then improving the health of a population. Of course, this is critical. This came from really public health framework and population health framework, and that's why that piece is in there. We know that's very important. We, of course, in this program are focusing primarily on the individual person, but that same still resonates. We're still very conscious of of population health. And in population health, there's no cutoff for it. It doesn't mean that population health is something that's greater than 10,000. Certainly population health can be that of which is in your own house, the population of the folks that live in your own house. And then some management of the cost, that putting resources together we know is going to help improve the spending that we all incur from a program like a healthcare type situation. So we know that there's efficiency in numbers for sure. So what does this mean here at Creighton? So intercollaborative in our Healthy Lifestyle Management program at Creighton, as we design the program, means that we bring in medical anthropology, we bring in psychology to specifically, address that side of the health behaviors, or that at least that component, and they're not the only ones that are going to talk about it in your program, nor are the medical anthropologists the only ones that are going to talk about the social side of what it means to be healthy. But bringing those two professions in, along with folks from communication studies, because what we've got up here does us no good unless we can bring it to folks out there. So we need to have this ability to communicate with individuals. And so those three programs around, of course, the new program of Healthy Lifestyle Management in the courses, and sometimes I'll refer to them as glue courses, because it takes these three other pieces and kind of molds them and glues them together in a way that makes sense to help folks improve their overall well-being. So this is what it means for us, and it certainly is not all-inclusive, because under the HLM program, we will be incorporating spirituality, the finance and economics side of things, and hopefully civic engineering to talk about the physical environment. There's so many factors that affect health of an individual, and those are kind of all couched underneath the HLM program, aside from the disciplinary focuses of psychology, medical anthropology, and communication. In case you don't know exactly what medical anthropology is, I put the definition up here for you, because this may be your first exposure to what that is, and this is one area that very much resonates with what we're doing here in the HLM program, because it looks at the social side of what determines health. It's very important. So that's why there are a couple courses for our program in there. Here's some resources for you to get more information about interprofessional, interdisciplinary, intercollaborative care. The first one there is a very good one, the National Center, because it both focuses on the practice and the education. There's a link for medical anthropology if you want more information. And this is something we're going to talk about in our next module, is lifestyle medicine, and that certainly is a very critical part of the HLM major and piece. But just to give you a little primer for the next module, I put the link in there for the organization, the National Organization for Lifestyle Medicine. That is the American College of Lifestyle Medicine's website. So there you have it. That's Module 2. Certainly there's lots of information on this, much more than just what I have shared with you here in this short video, and hopefully it has given you a bit of insight, a bit of appreciation for what the importance of us coming together. The biggest thing I hope that you take away from this module in talking about interdisciplinary care or collaborative care is that we as wellness, well-being professionals are not in this to just work alone. We have to be working with other people that are surrounding the individual we're working with in order to improve their care as best they can. Remember, this isn't about us. This isn't about us and doing just this for our own reason and trying to tell somebody everything that we know. This is all about individual we're working with. And if that's truly the case, and if this is truly about care personalis and care for the individual person, care for the whole of that person, then we need to have a team around them and everyone involved, including their family, the other healthcare professionals, other support people, and those can be friends, it can be neighbors, whatever the case may be. That's what it means to be working within a team. Obviously, there are a lot of challenges with that, a lot of barriers. Our system doesn't necessarily support it yet, but that's the direction we're going, and that's the mindset we need to have, because that's what is best for that person we're working with and working for. All right, so if you have any questions, let me know, and I will talk to you again in Module 3. Thanks.